R. Shrikant, Secretary, Physical Education Federation of India, Karnataka, faculty members from other institute, faculty members from Indian Academy Degree College Autonomous, and dear students, a warm welcome to all of you to this national webinar on sports injury management, a scientific overview organized by the Department of Physical Education, Indian Academy Degree College Autonomous, in collaboration with the Physical Education Federation of India, Karnataka chapter. A sound body is the seat of a sound mind. Physical fitness is the first requisite of happiness and the basis of dynamic and creative intellectual activity. Sports and games play a pivotal role in building up physical, mental, and moral health of individuals. It also imparts discipline, determination, mutual cooperation, self-control, strength, which form the total character of an individual. Sports injury management aims to restore the injured athlete's function and performance level, return the athlete to the sports participation in a safe and timely manner, and minimize the risk of re-injury. With this brief note, I now request our principal, Dr. E. Jerome Xavier, to give the introductory remarks.
Respected participants of today's webinar from all over India, the organizing committee members, Mr. Prasanna Gowda, the Physical Education Director of Indian Academy Degree College Autonomous, Professor Sangeeta, Professor Shubha, Professor Deepa, Professor Kesavan, and Professor Sharad. Good afternoon to one and all. I'm extremely glad that the Department of Physical Education has recognized its role in today's context and shared with the rest of the teachers, lecturers, and students on a topic that is very relevant and important from the point of sports and games. The injury management, for which rightfully we are chosen two resource persons from medical field. Both are well qualified doctors who can treat particularly the athletes who are injured in the field of games or sports. All of you would agree with me, higher education institutions of excellence and which are outstanding have always been shown that they are not only academically sound and excel, but also equally they are good in sports and games. We find students from these institutions not only participate at the inter-university level, but often represent our country. Hence, one of the hallmarks of eminence of institutions or excellence institutions is the way we create our students to be outstanding sports men and women who can represent our country in the latter years. Physical education is no doubt equally important when we look at the holistic development of individuals in higher education institutions. It is not only developing our mind or intellect, so developing the fitness of our body, and to ensure that our students are given enough opportunities during their stay in the campus. We know men and women who are committed to sports and games are well disciplined, well focused, and their goals are very, very clear. One thing that all of us need to learn from these sports men and women is get out of fear. We know well that a person who is participating in pole vault will not even have a fear of jumping to the height and then jumping down or falling down and landing safely. If they have fear, surely people will not participate in such events. People who are involved in hockey games or football, they all know while they participate and play well, they take risk, they might get injured. Nevertheless,
With my presentation. In case if any problem is there, please let me know once the presentation is going on. Okay. Ma'am, you can.
Doctor, you could be a little more louder. Doctor,
Okay.
you could
Okay.
be louder. Please be
Okay.
louder. Please.
Yeah. Now it is fine, sir.
Yes, sir. Yes, doctor. Thank you.
Okay. Fine, sir. Ma'am, can you share the slides? Hello.
So kindly wait. There is a technical
Yeah.
issue. We're just checking
Okay.
it.
Okay. Okay. No problem. Just let me know once it is
Yes, sir.
coming on.
I request Mr. Jenu to kindly turn off your video. Kindly turn off your video, sir.
Yeah.
Sir, you're able to see the presentation, sir?
Yeah, it's loading, right?
Yeah, it's loading.
Okay. Yeah. Okay. So, good morning, everyone. So today my session will be covering the following aspects. It will be what is a sports injury? Am I audible? It's fine. The level of audio is fine.
Your audio is fine, sir.
Yeah, fine. Okay. So today I'll be just focusing on the topics. Ma'am, I think screen is has not come.
Yeah, screen. 1 minute, sir.
Okay. Yeah.
So kindly pin the screen, sir.
1 minute. Ma'am. Yeah, I've pinned. Okay. Thank you.
Thank you, sir.
Okay. So in today's session, we will be focusing on the following topics. That is sports injuries, level of prevention of sports injuries, and what there is one prevention model will be there. We will be just discussing the prevention model, acute injury management, principles of first aid, aims of first aid, and dealing with the emergencies. So these will be the topics we will be discussing today. Ma'am, second slide, third slide. Third slide, ma'am.
Yes, sir, they are doing it.
Yeah. So I'm segregating the topic into two. First, we'll be just focusing on sports injuries, their prevention as well as their treatment. And in the second aspect, we will be focusing on the first aid part. Okay. Sports injuries, it is a wide term or it is a wide spectra. So it cannot be explained in a single class. So I have summed up all the points which will be easily understandable for everyone. And I have made a few points. And in case any during the discussion, if any doubts are there, we will have the discussion over that in the discussion section. Okay, so let us start the presentation. Next slide now. Okay, sports injuries are usually the injuries that occurs during any athletic activities or exercising, which every one of you can know. So it can result from accidents, or sometimes it can occur due to poor training and also due to poor techniques in the practice. And if there is an inadequate equipment and there is an overuse of any particular body part. Accidents, you know that once a collision between two players occurs, poor training in the sense like if the training is not adequate to their level or the technique that they are using is very bad. So in those conditions, then they will be more prone to any injury. And if the equipment is inadequate, like we know that Sachin Tendulkar developed tennis elbow mainly because of the reason that his bat was a heavy bat. So that was one of the reasons that he developed an injury. So inadequate equipment, that is an example for an inadequate equipment. And overuse of a particular body part, we know that throwers are more susceptible to upper limb injury. So if one particular part is being continuously used, then that person will be having a chance to get more injured. Next slide. Okay, so as a sports medicine clinician, the main role of a physiotherapist is to minimize the activity related injury. Okay, and also the health professionals working with the team will initiate some injury prevention strategies, means how to reduce the injuries. So in the next slide, we'll be seeing what are the strategies we mainly use. So next slide. So we are following a certain pattern that is known as the systematic injury prevalence, pre and in-season strategy planning with the coaches, regular screening of the athletes, and development of specific prevention programs for the team as well as for the individual athlete. Systematic injury surveillance means we will be doing some surveillance, like before the event. If the player is there, we will be conducting some screening that is known as the pre-participatory evaluation. So in the pre-participatory evaluation, we will be assessing his all the parameters of fitness, like body mass index, power, strength, endurance, cardiovascular endurance. All these parameters we will be checking, and after that only we will be telling that whether he is fit for the game or not. And the same time, if a person is fit in the season, before the season, there can be a chance that he may deteriorate his condition during the in season. So in season also, we have to just keep on monitoring that whether the patient or the person or the athlete is developing any musculoskeletal symptoms, like any injuries are happening. And also during the season also, we have to certain strategy should be there, because I think many of you are from different games. So let me tell an example of football, that some players will be needed for a key match. So what we do is, like, we'll be keeping that person in reserve and just putting him for some warm-up matches and giving him some warm-up, and after that we'll be calling him back. So this is a strategy that we usually do, like for a particular game we'll be keeping a person. So such strategy has to be planned along with the physiotherapist, so that his conditioning will be done side by side, so that his fitness will be there for the next game. And usually during the season, we will be conducting regular screening of the athletes, so that they won't be having any musculoskeletal symptoms. And if we find that any person is developing any such sort of injury or something like that, we will be creating a injury prevention strategy for the team as well as for the individual athlete. The team should have a particular fitness. They have to play for a particular time. If it is athletics, particular strategies are there. For each game, the strategy usually changes. Next slide. So next slide.
Hello, Nitin sir.
Sir?
Nitin sir, there's a slight technical issue. I'll just
Okay.
go with the full screen, sir. Just give me 2 minutes.
Yeah, okay.
Yes, sir. Now is it fine?
Yeah, so fine. Okay. So, yes, this. Okay. So while telling on the sports injury prevention, there are 3 levels of prevention. That is primary prevention, secondary prevention, and tertiary prevention. Okay. So each level are having a different aspect in their prevention. So let us see what are the levels of prevention. So next slide.
Now it's okay.
Next slide. Sir, can you go for the next slide?
Next slide, please.
Okay, so the primary prevention, we mainly focus on the health promotion as well as injury prevention. So let us take an example that an athlete is there, he does not have any injury, but we tell him, or he practices a pattern of wearing an ankle brace to prevent an ankle strategy. So the primary prevention, even though injury is not there, we mainly focus to prevent the injury or not letting the injury to happen. That is the primary sort of prevention. Okay. So in the same time, like which I have told, pre-participatory evaluation, and we'll be checking the fitness. So it is a part of the health promotion, so that we can get to ensure that the person is properly healthy and we can prevent the injury, because if the optimal level of fitness is there, then the chances of injury will be less. So this is a primary level of prevention that we will be mainly focusing on the health promotion as well as injury prevention, so that the injury, we are not letting the person to have any injury. Secondary prevention. In the secondary prevention, what we do is like, let us take the example of an athlete or any sports person who has uh, happened at ankle sprain. Okay. So if a person has an ankle sprain, the person will be coming to us telling that I'm just having a pain in my joint. So the thing is like, we will not be able to understand the condition unless and until we assess the particular person. So once we assess, we get to know that this is an ankle sprain. So we will be doing some particular strategies so that the ankle sprain can be limited or further injury can be limited. So that is the secondary. Secondary means already something has happened. We will be employing some strategies so that we will be uh, reducing the risk of any re-injury or a development of any disability. So if you treat the ankle sprain very fast, then obviously patient will be coming back to the sports very fastly. Okay. And next one is the tertiary level of prevention. Tertiary level of prevention, it is actually meant, let us take the example like a person has ankle sprain, and he is getting recurrent ankle sprain. So what we will be focusing is like, we will be finding out the underlying factor that may be causing him this ankle sprain. So we, on examination, we may find that the person is having any balance problem. So if any person is having any balance deficits, obviously he can go for a ankle sprain. So what we will be doing is correcting the problem, that is underlying problem, and we will be giving taking back him to the sports very gradually. So that is the tertiary level of prevention. So tertiary level prevention is the rehabilitation to reduce the existing disability that will be causing this particular disease. So I am repeating it again: three levels of prevention: primary, secondary, and tertiary. Primary is mainly prevention. Secondary is limiting the development of any particular disability, or we will be limiting the re-injury. Tertiary, it has already happened, so we will be mainly focusing on clearing the underlying problem. So we will be getting athlete on all these three areas. So depending upon the condition of the athlete, we will be preventing the further injuries. Next slide. Okay. So now we are going to discuss a sports injury prevention model. So being a sports physiotherapist as well as being a coach, the main thing that affect is the injury of the players during the tournament or during the season. So what we have to do is like, before a season itself, we will have to find out what is the magnitude of the problem, and we will be describing like which injuries are more in my particular game. If I tell in football, if we see, we can have more injuries to the hamstring as well as quadriceps, and some sort of ankle sprain also we can see. In case of martial arts like taekwondo, there also ankle problems as well as hamstring injuries will be more. So based on the game, each game, the injury incidents will be different in each person's, okay, or in the each game. So we will have to find, the first thing to reduce the injuries, like we'll have to find that which injury is more in what game and how much severe it is. Okay, so once we find that which particular injury is more in which game, we'll have to find the underlying risk factors. Some risk factors will be there which will be causing that particular problem. Sometimes it can be injury mechanisms. Injury mechanisms means some if the throwing is not proper, or if any other during his movement any particular problems are there, those are the injury mechanisms, or sometimes it can be due to fall. So these factors and all we'll have to find out. So after finding out these particular mechanisms, we will be again introducing some measures to change this risk. Suppose let us take the previous example of ankle sprain. So suppose one of us is into a football team, and once we observed that in the football team, uh, many persons are having ankle sprain. So we just found that once assessing the risk factor, we found that they are having some balance problems. Okay, so once we found out the balance problems, we will be mainly focusing on their balance training. Once the balance training is done, we will be reassessing them once again, how the injuries, whether the injury is happening again, or whether the incidence of the injury has come down. Like that, we will be giving a screening. So it is a system. This is what which I was discussing in the first part. This is known as the systematic screening. First, we will be analyzing which injury is more and how much severity the injury is, and we will be finding out the risk factors as well as the injury mechanisms. So after finding the risk factors and injury mechanisms, we will be again going back and clearing that one, and we will be just checking it once again that whether it is getting clarified or not. Okay, usually while following this injury prevention model, we usually have a positive result. So the athletes will be clear from many of the injuries. Next slide. Okay, so in the previous slide, you have seen that some internal risk factors, intrinsic risk factors you have seen. So this is a model which usually tells that how an athlete gets an injury. So there are three factors, that is the internal risk factors, external risk factors, as well as the inciting events. I will tell each things one by one. Internal risk factors means the factors that lies within the athlete, that are known as the internal risk factors. So let us discuss it one by one. First one is age. Age, in the sense, we get to know that being coaches, all of you might have known that during the growing period, that is during the adolescent period, as well as once we go for the veteran meets and all, the injuries will be more, because these are the two age groups where the person will be having a limited flexibility during the growth period or during the puberty period. For the sports persons, flexibility will be less. At the same time, once we get into the old age also, the flexibility will be very less. So there is a chance that these particular two age groups will have a more tendency to get injury. Next one is the gender. Some games or some injury is more predisposed to girls, like ACL injury. Females are more involved than males. Then talking about the body composition, every one of us know that if the body mass index is affected, like if there is an improportionate body composition, then the chances for a person to get injured is more. Suppose let us take an example of a person who is heavy in his upper part. So his lower body will not be able to bear the weight of the upper part. So he is more predisposed to an injury. Same like in any of the part, it can happen. So this is just I'm giving an example. Next factor is the health. If any previous injury is there or any previous joint instability is there, then the chances of injury is more. Just like what we have told in the case of ankle instability, means ankle injury. Suppose the person is having an ankle instability, the chances for a person to get an ankle injury is more. Next one is physical fitness. If the physical fitness is less, that means the joint strength, power is less, and joint range of motion is less, then the person is have a more chance to get an injury. Joint range of motion is that through what range the particular joint moves. If we see the shoulder joint can go for 180 degree of movements. So if the shoulder is not going for 180 degree of movement, the thrower can develop a particular injury. And if his rotation movement is not proper, then also he is more prone to have an injury. Next one is anatomy. Anatomy is the alignment of the particular body segment. We have seen many patients with some problems in the anatomical alignment. Usually in females, there is a condition that is known as genu valgum, or means the angle of the knee joint will be slightly different from the others. So in those persons, injury can happen to the patellofemoral joint. Patellofemoral joint means the knee joint. In the knee joint, there is one particular joint that is known as the patellofemoral joint. So in this particular joint also, there can be injury that can happen. Then next is the skill level. That is a sport specific skill level. So we can see that a novice athlete, means an athlete who has started his career, will be getting more injuries than an elite athlete. Main reason is like he will be putting his maximum effort. Once he put the maximum effort, what he does is like he'll be creating too much of mistakes. So during that mistakes, the person will be getting more of an injury. So these all factors, these are the internal risk factors that can make a person predisposed to the injury. Predisposed means he'll be having a chance more than the others to have an injury. Means just like I told, young age will not be having that much chance for an injury, but old age will be having a more chance for getting an injury. So these are the internal risk factors which make the athlete predisposed to get an injury. Next, we will see the external risk factors. External risk factors means something that is outside the athlete, that is known as the external risk factors. External risk factors includes human factors. Human factors is like sometimes teammates themselves can create a problem to the player, or the opponents can also create a problem to the player. sometimes the protective equipments like helmets, shin guards, they also can create an injury to the person. And sometimes sports equipments like skis, like just like I've told, Sachin Tendulkar, I told bat was heavy. So same like sports equipments can also create some problem. So in the case of Sachin Tendulkar, if we take, we can see that the person, he was fit, every aspect of fitness was there, but one particular equipment was there, means that is outside his body, that was creating the problem. So outside the things can also make the problems. Next one is the environment. We usually know that weather usually plays a major problem in the uh, plays a major role in the creating of a sports injury. Like once we see that, once we take the South Indian athletes to the north side during the winter season, it will be very difficult for them to attain the warm up, and soon they will be getting the cool down. So it is very difficult for them to, to put out the maximum performance. Same like once the North Indian side athletes come to the South India, there is a problem with the humidity, so they will be more posed to the dehydration with the increased humidity. So this can also cause some problems. Okay, next one is the floor as well as turf type. If it is concerned to the indoor games, the change in the turf can cause many injuries. So these are the factors that are outside the human or the person, individual. So these are known as the extrinsic risk factors. So already a person who is having some internal risk factors, with the presence of these external risk factors, he will become a susceptible athlete, susceptible to injury. So he is already susceptible to injury, but some factors can cause this particular um, injury, that are known as the inciting events. Inciting events is the playing situation. If the athlete is in a means if he is feeling that he should win this game, so the player behavior will be aggressive one. So that can cause an injury. Next one is the player as well as opponent behavior. If this match is a final match, or if it is a tough match, or it is a game deciding match, then the player as well as opponent behavior will be more aggressive one, that can cause a more injury. So that is the player as well as opponent behavior. Gross as well as detailed biomechanical description is like once the person comes into a this particular uh, stage, like if it is a tough match, what happens is like the skills that they are used to will not be followed. They will be using the skills, means they will be abruptly playing, that can cause them injury. That is mainly the gross as well as detailed biomechanical description. It is a bit vast topic, so I'm just summing it on that. So if a person, I'm just summing up this model once again. If a person is having any of the internal risk factors, he is known as a, means he will be predisposed to the injury. And if the external risk factors act upon, he will be becoming susceptible to the susceptible to the injury. And inciting events, if it is there, then the person can get an injury. So this is a common thing. So in the previous model which I have told, like we will be finding the risk factors and we will be clearing that one. So while seeing this one, the risk factors for the athlete, we are just seeing that the body composition is less. So we will be mainly focusing on making his body fit. Next, if any physical fitness is less, we will be mainly focusing on the physical fitness. If anatomy is affected, we cannot change that much, but with the use of some brace or something, that we can reduce the impact. And skill level with training, which coaches can give, then we can give this skill level training. So in all these factors, we can maintain by this method. Protective equipments, we should use protective equipments which will be suitable for the athlete. And if we environment, we tell it as acclimatization. Once any person goes to any particular area, they will be camping in that area a few days before, so that they will be adjusting with the climate and they can perform well. That is known as acclimatization. So these risk factors we can prevent. So risk factors are the ones that we can modify. So preventing these risk factors, we can let the athlete prevent from the injury. So these are the risk factors which we have already discussed. So first we will be seeing the incidents, then we will be finding out what are the risk factors. And once we find the risk factors, we will be going back and clearing these risk factors, and we will be once again checking, and we will be just clearing the problem so that the athlete will be free from injury. Next slide. Okay, so now let us see that if an athlete has sustained an injury, usually we see an injury in the ground that are known as the acute injury. Acute injury doesn't mean that it is small injury. We classify the injury into two phases, that is acute injury and well as chronic injury. And some others also tell that there is a subacute phase of injury also is there, or acute exacerbation of chronic condition also it is there. So acute injury management means that soon after an injury has happened, to the 3 days that is known as the acute injury phase. So acute injury means usually during an acute injury, there will be an inflammatory response. So that we usually see if an athlete is means just a moment before he has fallen down, he will be mainly telling that I'm having a pain. No, sir. Previously. He will be having a pain, and sometimes redness will be there, and swelling usually comes if it is a great injury, means it's a magnitude it is greater, then swelling will be there, and loss of function. Loss of function means if he is not able to walk, he is not able to run. Those are known as the loss of function. So acute injury usually is having an inflammatory response, and these inflammatory response are clinically shown as pain, redness, swelling, as well as loss of function. So the question is like whether the inflammation is an essential process or not. The answer is like inflammation is an essential process. Why? Because it is helping in initiating the tissue regeneration as well as repair. Immediately after an injury happens, the redness usually comes mainly due to the increased blood supply to that particular area. So it is helping in one way. It is helping in one way that the blood will come into that area, so the waste materials will be taken off from there, and it will be giving nutrients to that area to heal. So inflammation is an essential process. But next slide, sir. Excessive bleeding to that particular bleeding doesn't mean it is outside. Inside also bleeding can happen. So if it is an excessive bleeding that happen in that particular area, the swelling that is known as the edema will be present over that particular area, and it can delay the recovery. That means it can cause, means since the blood is too much coming to that area, so it can cause some ischemic damage. Ischemic damage in the sense loss of blood supply to the areas, so to the nearby tissues. So if usually we can see that if a person is injured in his ankle joint, we can see that the muscles that is supporting that particular area will be having some particular weakness. That is an example for this secondary ischemic damage. Means the blood supply is more focused to this area, so blood will not be able to flow to the other area. So this can cause an injury. So it is a deciding factor that how should we reduce this excessive bleeding. Next slide. So usually we follow some protocol to reduce the injury. Means the during this acute management of any injury, we usually follow some protocols. Previously, it was used that the protocol is known as the price protocol. Price protocol, I will expand. P for protection, R for rest, I for ice, C for compression, and E for elevation. So that is the price protocol. Okay. So with recent studies, many have come up with a new protocol that is known as the POLICE. POLICE, it is already given that it is protection, optimal loading, compression, ice, compression, and elevation. So the phase of rest is taken away because the recent studies have shown that if that particular part is given a loading, then only the injury rehabilitation or the healing process can be accelerated. So that is why the rest was taken off with the optimal loading. So let us see what is protection. So next slide. Protection, actually it is a brief period of complete immobilization which is necessary to prevent excessive distension at the injury site. Same, it is like if some part of the body is injured, we will be just suppose the basic example is that once we get any hit on the hand, we will be just keeping our hands close to our body, right? The main reason for that one is like we will be protecting our hand. So same like that is a mechanism. We will be immobilizing that particular part so that any further injury can be reduced from that particular part. That is known as the protection. So the main aim of this protection is to reduce the size of hematoma. Hematoma means the blood over that particular area, and thereby reducing the scar. Scar tissue, I can just give you an example. Like imagine that we have a cloth at home and that cloth has torn. So what we do is like we will be just stitching that cloth, and if that stitching is over there, once we pull that cloth, the cloth will not be having the same flexibility that it had. So that stitch that we made, that is known as a scar tissue. Means that's not it can be considered as a scar. So same like if a person is having scar tissue in the muscle, then his movement will be less. We can see that any persons will be telling that after an injury, they will be telling that I'm not able to move my hand as before. The main reason is this presence of this scar tissue. The body is healing itself, so it will be making the scar tissue over there. So it will be hindering the rehabilitation process. So if the hematoma size is more, so the chances for the connective tissue scar to form is more. So main thing that we'll be doing while protection is to reducing the scar formation. So as much as we can reduce scar tissue formation, easy can be rehabilitation. So during this phase, we will be using the cast, splint, rigid braces as well as in other supported devices to protect the injured part. So if any part is particularly injured, we can give this cast, splint and rigid based braces to protect. Rigid brace in the sense like it will be hard so that movement will not be possible. Okay, next one, next slide. So next thing is like determining that how much the immobilization should be. So if the immobilization is more, then it can cause detrimental effects or the negative effects to the healing of soft tissue, which I have already discussed. Immobilization can lead to joint stiffness. We know that once if any our hand is fractured, we'll be immobilizing plaster of Paris cast, and after some time we can see that after some time we can see that the joint has gone for a stiffness, and it can also go for a degenerative changes. Degenerative changes mean some changes that is not good to the joint because it can cause pain and many other problems over there. That is one of the degenerative changes. Usually with the muscle weakness, degenerative changes.
Dr. Sham, kindly mute yourself. Dr. Sham, kindly mute yourself.
Thank you, ma'am. Thank you, sir. Next is like whether we should go for a short immobilization or a prolonged immobilization. Short immobilization.
Line training.
Short.
Dr. Sham, please mute yourself.
He may be your friend, that resource person.
Okay, thank you, sir. Thank you, ma'am. So short immobilization, it mainly depend upon the extent as well as nature of injury as well as the tissue involved. If we see that the injury is not of a severe intensity, or if it is very means it's light intensity, or we can tell like it's a mild injury, so we can go for a short immobilization. But if the injury is of a higher grade, like we tell it as grade 1, grade 2, grade 3, if the injury is of a grade 1, we can go for a short immobilization. If the injury is of a grade 3, we can go for a prolonged immobilization. So there is a factor that should be deciding whether we have to go for a short immobilization or a prolonged immobilization. Next slide, ma'am. So this is what actually tells about the how the immobilization has to be. Usually for muscle injuries, we tell like 2 days is only sufficient. But for a ligament injury, it can take up to 10 days of loading, where we can give control loading. So next we are going for the portion of control loading or the optimal loading or loading how it has to be given. Next slide. This is optimal loading. Optimal loading studies has been there. It has been conducted that persons were given rest as well as persons were given optimal loading, and the group that has received optimal loading has shown a much beneficial effect than the group that has gone for complete rest. It is mainly the thing like once we all know that if we go for any optimal load, means once we give any stress to the particular structure, then automatically that structure will develop its strength. So that is why we tell that optimal loading has to be given. And we also need to consider some factors whether we should give or how much intensity we should give the loading. That includes the magnitude, duration, frequency, direction, and intensity of the direction and the direction of load. We cannot, as a whole, we cannot give the load. We can give it part by part or gradually we can give the load, and we should follow all these factors that the magnitude, duration, frequency, direction, how intense it should be, and in which direction we can give. Suppose in case if the person is having any ankle sprain, we will be mainly telling like you can use the heels and walk. And sometimes any other injuries are there, will be telling like you can walk but give some support. So these are the things like optimal loading. So once the person has that achieved that particular sort of walking with the assisted device, we will be slowly discontinuing the assisted device and we'll be telling them you can walk freely. So that is known as the optimal loading. Next slide. Next is ice, which we all know that ice is a common treatment modality that we use in the initial management of acute musculoskeletal injuries. In every sports field, we mainly manage every person with ice, the use of ice. The main use of ice is reducing the edema. Edema in the sense like reducing the blood supply to that particular area, which I already told. If the blood supply is more to that particular area, it can delay the healing process. So once we apply the ice, the blood supply to that particular area is cut, and thereby it reduces the secondary injury that can happen to the other tissues. Okay, so that is what we do with the ice. So next slide. So let me tell the physiology or the function that happens behind the ice. Actually, it is like when the skin temperature goes below 15 degree. That means once we apply the ice, the skin temperature can go below 15 degree. So once it goes below 15 degree, then the person will feel a local analgesia. Local analgesia means analgesia in the sense it is meaning that loss of pain sensation. So it is mainly due to the reason that the nerves that carry the message of pain to the brain, that that will be reduced. That speed of that conduction will be reduced. Okay, so if ice is there, the pain conduction velocity will be reduced if the temperature goes below 15 degree of temperature. Okay, so usually drop between 21 to 25 degree is seen, but some questions has been raised like what, how it helps in the a person who is fat or having a more adipose tissue, how it helps. It is still a questionable thing, but still we suggest that ice is a ice as the best method or best modality that we can give in the on field. Next slide. Next one is compression. So we have already told that there is a chance for the swelling to come. So usually after any soft tissue injury, there is a chance for this swelling to come. So what we do is like if we compress that particular area, what happens is like blood will be pushed back to the upper parts. Okay, so we will be just creating a pressure gradient so that it will be counteracting the edema. And usually followed procedure is like combining ice as well as compression together. It can cause reduction in the swelling. Next slide. So one problem that we usually face is like bony prominence. If it let us take the example of ankle joint, it is very easy to explain ankle joint. That is why I'm keeping on telling that ankle joint and ankle joint. So ankle joint, it is having two bony prominence. If you see from the ankle joint, we can have two bony prominence over that area. So if we feel that the pressure is more over that area, we can use some materials to fill that particular gaps. And we usually tell that it should be an pressure of usually 15 to 35 millimeter of Hg, and we tell that just to tell this fact, that is distal and proximal. Distal means the part that is away from the body, and proximal means that is towards the body. Okay, so we usually tell that suppose the wrist joint is injured, we will be starting the bandaging from the just below the fingers. So just below the fingers, we will be just bandaging that one, and we will be bandaging it such that it is overlaying each other by one half, and it should be extending one hand breadth towards the body, right? Like beyond the wrist, it should move around one half. That is what it means. In case if any doubt is there, we'll clarify during the discussion session. Next session, next slide. So the last one is known as the elevation. Elevation actually it means like the body part that is injured, it should be above the heart level. The thing is like we know that if usually blood flows or water or anything, the fluid usually flows from a higher level to a lower level. So just like we are told, during any acute injury phase, there will be some sort of edema or inflammation in that particular part. So if we delay that means if we prolong that swelling over that particular area, then there is a chance for this particular condition to get deteriorated. So we have to bring the blood back to the heart level. So what we can do is like just elevating the limb above the heart level, or it is just we can tell like above the pelvis, just limb just lift the lower limb. That is it. Okay, and this is what elevation usually does. So the whatever fluid is over accumulated over there, it will be returned back to the body. Okay, next slide. Sir, I'll be answering the question in the this one. Let me finish. After that, I'll be answering to a query. Okay. So what we usually tell is like do no harm, and do no harm in the sense like harm stands for HARM. Harm in the sense avoid heat as well as heat rubs, avoid alcohol, running as well as moderate activity should be avoided, massage or vigorous soft tissue therapy should be avoided. Heat or heat rubs in the sense like we Indians, we usually have a practice of applying heat to the particular area. So we just came to know that once we do ice, blood circulation to that particular area will be reduced. So once we apply heat, what happens is the exactly opposite, that it will be increasing the blood flow to that particular area. So once we give hot during an immediate or acute phase of injury, what happens is like the chances for blood to come to that area will increase, again swelling will increase, then all the problems will be happening again. So better to avoid heat. Next one is using the heat rubs. We usually follow the practice of Volini and all those gels as well as sprays. These all are known as the heat sprays or the hot sprays or the hot gels. So if we keep on applying that one, again the chances of blood flowing to that particular area will be more. So better to avoid it during that phases. There are many cold sprays as well as cold creams that are available, which can give the effect of ice. So person will be having a almost, if the person is not having a facility to do ice, he can use the ice sprays or the cold sprays so that we can give the effect of the ice. Okay, next one is alcohol. Alcohol also increases the blood supply. Next one is running or moderate activity. Running or moderate activity, just giving an example, like if you have a torn cloth, if you keep on pulling that one, the cloth will be completely torn. Shail sir, I'll be responding to your query once I finish this session. I couldn't read that completely. I'll be responding to you soon after I finish this session. Okay, so heat as well as running or moderate activity. Once we, just like I told the example of a cloth, once we keep on pulling the cloth, it will be torn. Same like if we give running or moderate activity, if the tissue is already injured, again we will be causing more injury to that particular part, so injury will be aggravated. Next one is massage. Massage or vigorous soft tissue therapy also increases the blood supply to that particular part, so that injury will be aggravated. So that is why we tell it as a do no harm. Harm in the sense heat, alcohol, running as well as massage. So that is what is do no harm, and always follow the protocol of police. Police is protection, optimal loading, ice, compression as well as elevation. Next slide, please. And once the patient comes out of this acute phase, we usually go for this particular techniques, that is the manipulation and mobilization, soft tissue therapy, neurodynamic techniques, taping, electrophysiological agents. These techniques mainly, let me tell about the manual techniques, manual treatments. These treatments we mainly use to increase the joint range of motion. I have already told that if a person is having an injury, usually they'll be having a reduced range of motion, means they will not be able to move the hands as it was before. So we will be using this manipulation and mobilization techniques so that the range of motion can be increased. Soft tissue therapy is like I have told, is scarring will be there. So scarring, to reduce the scarring, we will be using the soft tissue therapy. Neurodynamic techniques, then same like muscles as well as the ligaments, nerves is also having some sort of elasticity. So if the nerve tension is more, we will be going for the neurodynamic techniques. And taping, as you already know, taping is a supportive sort of therapy. And one thing I have to emphasize is like, do not completely depend upon taping. Taping we can just use as an adjunct to our treatment so that the person will be having a support over that particular area. And electrophysiological agents, that modalities that we use like ultrasound, TENS and all, it will be mainly focusing on to reduce the pain as well as to improve the healing. So that is what the use of electrophysiological agents, and this is a short part of the treatment or the acute treatment that we give. Next slide, please. So let us come to the next part of our this webinar, that is principles of first aid. Next slide. Principles of first aid. There are 3 P's, that is preserve life, prevent deterioration, and promote recovery. You should always remember these 3 P's, that is preserve life, prevent deterioration, and promote recovery. Let us discuss these terms. That is, what all are these? So next slide. Preserve life. Preserve life means usually during any of the events, what we can see is like sometimes the person or the athlete can collapse. Usually have seen in martial arts like taekwondo, after the kick, they will be unconscious. So we cannot see that what is the actual condition. Since the patient is not responding, we cannot get to know that what that particular condition is. So since the person is unconscious, we have to check for three factors, that is the airway, breathing, and circulation. Airway, we will be checking where the person's breathing is, means airway, it is not compromised or not. So we'll be just checking that one. Breathing, whether the person's breathing is fine. And circulation, we'll be checking the pulse of the person. So we can find that whether these factors are there, then we can tell that the person is almost a normal one. And if any of these things is compromised, obviously we'll have to refer the person to higher medical consultation. Next one. Next one is prevent deterioration. All the injuries will not be a mild injury. Sometimes injury can be a worst injury itself. So we have to stop the bleeding. Bleeding in the sense like both the internal bleeding as well as the external bleeding. So if the bleeding is there, the blood volume of the patient can come down and he can go for a condition that is known as hypovolemic shock, which is little a serious case. So sometimes it can happen like that. So that is why we have to stop the bleeding as fast as possible. Okay, next one is treatment of shock. Treatment of the shock, it is both the psychological shock as well as the person will go into phase of shock. So we'll be mainly focusing on to reducing the shock. We'll be telling the persons, we will be consoling the patients, and we will be treating the other injuries also. So this is what actually we do in preventing the deterioration. Next slide. Next one is during how to promote the recovery is like we will be reassuring the person and relieving the pain, handling with the care, and protect that no harm is again taking place to the person. So these are the three P's. Next slide. So let me tell about the aims of the first aid. It is somewhat almost similar to the principles of first aid. One is preserve the person's life. Next one is prevent the worsening of the condition, promote the recovery. Other than these, let me add two more points. That is known as the help to ensure the safe transportation to the nearest healthcare facility. Usually, what we can see is like in many grounds, we will not be having any stretchers or any boards so that we can be efficiently transferring the patient. So if a person has sustained any spinal injuries, it is better to transfer that person in same level, because many of the injuries in the spinal injuries, it may get worse during once we transfer with means we are just carrying the person, then the spine will go for more compression, then the person will go for too much of an injury, means we will be aggravating the persons while doing mistakes in the transferring. And next thing is like prevent the cross contamination between you as well as the casualty, means we should minimize the risk of infection between us as well as the patient. So what we have to do is like cross contamination means infection should not be there. So if any open wound is there, you should not, the person who is treating the person should not contaminate themselves, as well as the athlete should not be contaminated with any problem. Means we will be touching the open wound without any gloves or something, so we'll be just touching that particular area, so person is more prone to have an infection of that particular area. So we should prevent these things. Other than the preserving life, preventing the worsening, and promote the recovery, two things I have to emphasize is like safe transportation and preventing the cross contamination. Next slide please. So how to deal with an emergency? Dealing with an emergency, mainly we focus on four mainly steps, that is making the area safe, evaluating the person's condition, seek help, and give first aid. Making the area safe, it actually means like, suppose let us take an example, like in an athletic field or in an athletic track, one person has collapsed. There may be a chance that the athlete that who is coming behind may step on that particular person, and both of them can get injured. So immediately, as soon as a person falls or if any injury happens, it is the main aim of every first aider or any volunteer or anyone who is standing over there is to make the area safe for that particular patient. Means just remove him from the site. Okay, so it can be anything, like if it is a not in case of sports injuries, in case of any case, we'll be following this protocol, that making the area safe for the athlete. And immediately once we make the person's area safe, one thing that we have to check is the evaluating the person's condition, whether the person's condition is okay or not, or if the person's condition, if it is too bad or if it is deteriorating, always seek help, means calling for the ambulance or calling for any medical help and just referring it to them and give the means while the medical help is approaching, you can give the first aid by yourself. Like in sometimes the spikes will be tight for the athlete, so you can remove the spikes and keeping the leg over that particular hip heart level. All those things you can give during the this particular phase. Next slide. So next one is providing the first aid. How to provide the first aid is like usually the main thing, like we will be mainly protecting the person from cold or heat. Usually we will be mainly protecting the person from heat, so that we'll be taking them to a shade and we'll be giving the first aid, so that further dehydration or any other problems may not happen. And one thing that you have to remember is like, do not give anything to drink or eat to a person who is severely injured, or if he is having a nausea. Nausea means the tendency to vomit. And if the person is becoming sleepy or falling unconscious, these are the symptoms that the person is developing or is having a brain injury. So if the brain functions are affected, once we give anything to eat or drink, then the person may go for a secondary complication. So we will not be giving any of these particular uh, things to a person who is severely injured, feeling nausea, becoming sleepy, or falling unconscious. Next slide. So to support the person who is having any injury, just follow these techniques. That is very easy. That is, tell the person, injured person, that how we are going to help him and reassure him that this is what is happened. So the thing is, like, once we see any athlete in the field, they will be in a shock that they have got an injury. So what happened to them is like they will be in a shock and they will be crying and all those things will be there. So what is the thing is like, first we have to gain the confidence of the patient. Just go to the patient, speak to the patient that who you are and how we are going to help him. So once we go, we tell like, and physiotherapist here, don't worry, nothing has happened. You just be relaxed. We are here to help you and nothing to worry. Like that, we'll be telling them and make him as comfortable as possible so that he will be comfortable with us and he will be able to continue with our session. Because if the patient is not cooperating with us, we will not be able to treat any patient and we will not be continue with the session. So what we do is like make the person as comfortable as possible, give them time to relax and speak with them, so that those all things will be helping. Next slide. And if he's worried, just tell him that it is quite normal, that it is not means you nothing is there, and if it is safe, call the family as well as the friends. Usually in the athletic field or any of the field, we'll be having either the coaches or we'll be having the co-players with them. So we'll be just calling them so that they will be getting a courage that they are not alone. They'll be getting someone with them. So these things can be done. So it is a good method so that we can reassure them that nothing has happened and all those things. And always tell the athlete that what has actually happened. So once we tell that what has actually happened, we will be getting means athlete will be having a less fear in that one. So that just if we see an athlete, we'll be just telling that just your hamstring has got a pull. Nothing to worry on that one. After, so for some time there will be a pain. After that, the pain will be getting reduced by itself. So we'll be applying ice. So by the time you please relax, slowly the pain will be getting relaxed. So keep on consoling the. Yes, sure, sir. I'll be telling about that, sir. This will be mainly telling about telling the athlete that what is happened and what is going to happen. And if we tell that if it is a condition, we'll tell like we are suspecting some injury. Sometimes it won't be there, but we are just for your safety purpose, we are just shifting you to hospital for further screening. So whatever it is there, just tell the patient what it is. Okay, next slide. So in a nutshell, I can just give some tips for you, the coaches, as well as for the physical education students. One thing is like recognize the severity of injury, severity of the injury, evaluate the injury, and know when to send for a medical expert opinion. Recognize the severity of injury is like with experience only we can get to know that how severe the injury is like. So I know many qualified coaches are there who have been going through many of these situations. So they will be getting to know that whether how severe the injury is like. And if it is not possible for you to evaluate the injury, call for medical help as soon as possible, and send if you see that the person's condition is very bad and it is deteriorating, always send for an expert medical opinion, shift him into hospital or anything that is possible at that particular time. Just go for that. Okay, next one. So tips in a nutshell, how to act in a emergency situation. It is like act calm and logically, be in control of the situation. You should control yourself as well as you should make control of the athlete or the injured person that is just before you. And speak gentle, but it should be firm and it should be purposefully to the person who is affected. Mainly the reason is like, one thing is like, if the person has gone for a fall, we will not be knowing whether the person has gone for any brain injury or not. So if we keep on speaking with the patient, we can get to know whether the patient is conscious or the patient is going into an unconscious phase. So these steps will be useful for us to report to the higher medical authority if required. So speak with the patient continuously so that we will get to know that whether the patient is fine or not. So that is what we will be mainly going through. Next slide. So avoid giving any misleading information that if the means mainly better to the bystanders and any of the coaches over there. I prefer like what the fact is there, just tell to the concerned person over there, just give the proper fact what it is and don't give any misleading information. And one thing that we have to always take care is that never leave the casualty alone and continue talking to him until the ambulance or the qualified medical professional arrives. Just like what I have told, once you keep on talking with the person, they will be getting a confidence and they will be a little bit relaxed because they will be in a shock or any particular anxious or depressed phase. So just keep on speaking with them and just try to console them. These sort of things can be done, and continuously reassure the casualty and keep on telling them what has happened and nothing to worry and all those, and obtain qualified assistance as soon as possible. Next slide. And one thing that I already told, like safe transferring of the patient is like avoid unnecessary movement. Just shift the patient as he is. Means just lift the body in a straight line. How the body means the body should be lifted in a straight plane. Just lift the patient and just transfer the patient, and so that no further movements will be there. So we will not be aggravating the condition. And if the same what I've told, if the victim is unconscious or vomiting, do not give anything to eat or drink, and protect the person from heat or cold or chilling or avoid overheating, and work in a quickly as well as efficient and organized manner. Means there should not be any haphazard over there, means running over there, running after here. All those things should be avoided. Whatever you do, it should be in a systematic as well as organized manner. So I prefer that first aid has to be always planned before the event. If and something will be happening over the particular area, how should we manage that one? We should have a plan for that one. Next slide. So once you are a volunteer or once you are there in the ground and medical professional is somewhere far away, what we can do is like just tell the injury what has happened. Sometimes the medical professional or the physiotherapist will be outside the ground. So there is a time till he reaches the athlete. So during that time, you can ask all the details. At the same time, you can also give the information to the physiotherapist that how the injury has happened. Suppose like if the person has fallen down, if he has hit his head on the ground. So all those things we can tell the person. So we, the clinical person or the sports medicine specialist, will be getting to know that how the injury has happened, what was the mechanism of the injury. So by knowing the mechanism of injury, we will be able to judge the situation. So report all the things that we'll be getting to the medical professional. And one thing that one query has come, like one thing that you have to ethics is like maintain the confidentiality and the protect the victims' right to privacy. So while giving any treatment, try to protect the person's privacy as well as confidentiality. Never reveal any details to anyone else. It should be within ourselves only. The ones who will be controlling the field, it should be within us only. And make every further attempt to avoid any further injury. And one thing I have to stress is like provide only the treatment that you are qualified to do. We will not be, some of us will not be qualified to give CPR. CPR in the sense like if he has gone for an heart attack or heart failure, the treatment that we give is not a CPR. All will not be certified to give a CPR. Giving CPR in a wrong way can make problems to the patient. So better not to give that particular treatment. Every one of us will be little bit qualified in the first aid. Whatever treatment that you know, just go for the treatment. And if you are not qualified in the treatment, better not to give that particular treatment. Okay, so I would like to conclude my session by saying a few statements that being an athlete or being a sports person, it should be the aim of everyone to be in the field as long as they can. So this pandemic will get over soon, and I would like every sports person to be in the field, because sports is the pulse of the world. Like sports help us to be active, to be healthy and all. So I would like to see everyone back in the ground with a much better performance. And if any particular injury is there, we can rehabilitate that one. So it can be a joint effort with the coaches as well as physiotherapists. So it is not a big deal. So be in the game, stay safe, stay healthy, and stay motivated. So next slide, please. Uh, Next slide. These are my references, and thank you.
Thank you, Dr. Nitin, for sharing your expertise and experience. Now the session is open for questions. Participants may post your queries in the chat box. So there are some questions. Can I go ahead with the questions?
Yeah, sure, no problem. You can go ahead now.
So there is one question. What is the difference between physical education and yoga? How to correlate physical health?
Ma'am, actually, answering to that question, if it is physical education and yoga, physical education, it's mainly about the overall well-being of a person. Like the games and all the activities will be there. Physical education, it mainly focus on the education about the physical parameters of a person. Means I think many physical education coaches are there. They will be mainly focusing on how to improve the game and what all are the factors in the game. So all those things will be taken in the physical education. And yoga, it is mainly posing about the poses, which is having certain health benefits on our body. So that is the main difference I find with the physical education and yoga. And I'm not a person to comment too much on physical education because I'm basically a physiotherapist. So it's out of my this one. So I think I have tried to explain this.
Okay, sir. Thank you. So the next question is, please explain the best injury management for a peroneal
Yeah, peroneal nerve injury in young sportsmen. So the thing is like nerve injury also it is having certain grades. Like we tell like let us take the example of a wire that we use. Means wiring. I'm audible, right? Hello. Okay. I'm audible. Okay. So peroneal means let us take the example of a wiring cable that we use at home. So wiring cable that is having an insulation on its outside and will be having a copper wire inside. So what happens is like if that outer covering is gone, then what we can do is like it will not be affecting too much of the function of that particular wire. But what happens is like if the insulation is totally gone, then chances of the muscle chances of any particular shortage or it can be there. And if it is completely cut, we will not be getting any electric connection. Same like a nerve is having many grades. We tell it as neurotomesis, axonotomesis, and neurotomesis, neuropraxia, neurotomesis, and axonotomesis. So based on how the injury is, then only we can tell about the what is the treatment for the peroneal nerve. If it is a first grade injury or that is a first level injury, obviously we can go with the muscle strengthening and electrical stimulation. All those things we can give and we can treat the condition. It's not that much a big problem. We have seen the persons after surgery also. If the nerve has gone for a complete cut, we have to go for a surgery. Otherwise, we go with the physiotherapy rehabilitation itself.
Thank you, sir. There's another question on safety ethics and rules in sports. Safety ethics.
Safety ethics, what ethics we usually follow, which I have discussed is like one thing is to maintain the confidentiality and maintain the privacy of the person who is injured. That is the main thing that we can do. And the thing is like always being the ethics, like the first prime focus of us should be to uh, reduce the impact of the injury and the person's means not to harm the person too much. That is the main ethics that we usually follow in the ground. Hello.
Thank you, sir.
Yeah.
So one more question is,
Yeah. Meanwhile, can I ask, can I answer the questions which I saw? Hello.
Hello.
Yeah. Meanwhile, can I answer some questions which I have shown in the chat
Yes.
box?
Yes, sir.
Okay. So one question was, what is an overuse injury? Overuse injury means if we are using any particular part for a prolonged period of time, and that injury which is caused over that area is known as an overuse injury. I will give you an example like a shoulder injury or a rotator cuff injury. Rotator cuff means that is a muscle that is seen in the shoulder joint. So if that muscle is prone for means repeated stress over that particular area, then that injury that develops with that particular overuse, that is known as overuse injury. So I'll tell some of the overuse injuries. It is rotator cuff injury for bowlers, overs, and all. It is an example for an overuse injury. Means if you are using any particular part repeatedly for a prolonged period of time, that is known as an overuse injury. And how to cure shoulder injury in cricket is like we have to find what is the underlying pathology actually, and what is underlying problem is there. So with that only we will be able to cure the shoulder injury. Means we have to find which structure it is, whether it may be ligament, sometimes it may be a capsule, sometimes it may be a muscle. So we have to just find out which particular muscle is that. After that only we will be able to tell that how to cure that particular injury. Ma'am, questions?
So another question. What are the reasons of knee cracking in young people who do not suffer from any symptoms? What are the reasons of knee cracking in young people who do not suffer knee cracking?
Okay. Knee cracking, I don't understand the term what is knee cracking. The two things that I'll just explain means what I don't get to understand what particular condition they are speaking. If they can tell about what it is, it will be more easy. Otherwise, I'll be just explaining that one. Two things that usually happens is like the popping sound that comes from the or knee pain in the athletes. Next one is the ACL injury. Usually these two means the first thing that knee pain or knee cracking that might be they have been referring for. So usually this knee pain usually happens due to the imbalance in the muscle. If we examine that particular person, we can see that there is a difference in the balance of strength between the hamstring as well as quadriceps. So this imbalance can cause to the change in the biomechanics of the knee joint, and this can cause a problem. So that is what I think he might have referred to. Is like they might not be having any problem outside. Means once we see from outside, they might not be having any problem. But once we examine them, we can see that quadriceps will be weak, hamstrings will be tight, and hamstrings will be having a less power. So that may be one of the reasons that they might be having this knee pain.
So there's another question. How to cure frozen shoulder? A frozen shoulder. How to cure?
Yeah, this is a question that is outside sports concept, but still it's nothing like frozen shoulder. It is something we can tell like if practically if I have to explain is like once we join any two things, like if we are joining any two sticks, we will be winding a thread or anything around that so that the stability will be more. So same like in case of frozen shoulder, what happens is like our shoulder joint is having two muscles means two bones actually. So those two bones are covered with a capsule. So once that capsule go for tightness, this frozen shoulder condition arises. So frozen shoulder, the main treatment that we can tell is like do the movements, and to reduce the pain, we have some certain modalities that can reduce the pain. And same thing is like we have to stretch the capsule. And while giving physiotherapy, the prime aim is to reduce the problem that they are having. And it is a frozen shoulder, it is a self-emitting condition. It usually takes around 18 months. So during that time, of 18 months, we have to keep on moving the hand so that the joint will not go for a stiffness, complete stiffness. That is what we can do.
So one last question, sir.
Yeah, please.
Which is the best training for rehabilitation of the anterior cruciate ligament?
This actually we usually follow, like first we'll be using close kinetic chain exercise. I don't know how to explain that one. First we'll be going for close kinetic chain exercise. Close kinetic chain exercise means, just I'll tell you an example. The first thing after an ACL injury, what we can see is that there will be limitation in the knee movements. So what we do is, like, we'll be telling the person to lie down on the couch and means facing our face facing upside, and we will be trying to bend the knee. That is known as a close kinetic chain exercise. So once that is attained, we will be telling the person to sit, and we will be telling them to do it in sitting, means leg hang, and we can tell them to do. That is known as a open kinematic chain. So this is actually how we progress. Discussing about the treatment of ACL injury, it is a big session. So mainly we will be focusing on improving the range of motion, improving the strength, improving the muscle power, and returning back to the sports. These will be main, improving the balance and returning back to the sports will be our major concern in the ACL treatment. So ACL treatment, also one thing is that with the surgeons, how the treatment is, the protocols can also change. So this is how I can superficially tell about ACL injury rehabilitation.
Thank you, Dr. Nitin. It was a wonderful talk.
Yeah, ma'am. Thank you, ma'am. Thank you a lot. Any
My
other
pleasure, sir.
questions?
No,
Can
that's
I-
it, sir. Yes,
Okay.
sir.
So once again, I thank Indian Academy Degree College as well as Physical Education Foundation of India, Karnataka chapter, for giving me opportunity. Once again, I'd like to thank Dr. Radhakrishna, Prasanna Gowda sir, Srikanth sir, and Srinivas sir for all their helps. And I would like to thank all the participants as well as listeners who has actively participated in the session and come up with the queries and doubts. I think I did did justice to my presentation. And in case any doubts are there, you are always free to speak with me. And thank you, everyone. Once again, thank you.
Thank you, Dr. Nitin. May I now request Professor Sangeeta Annie George to introduce our second speaker?
It's my privilege to welcome and introduce the next speaker, Dr. George Matthews. Dr. George Matthews is the Associate Professor and Medical Officer, Sports Authority of India, Lakshmi Bai National College of Physical Education, Trivandrum. Doctor has done his MBBS, PG Diploma in Physical Medicine and Rehabilitation, and DND in Physical Medicine and Rehabilitation. He has over 30 years of experience in the field of sports medicine and physical education as an academician at Sports Authority of India, LNCPE, Trivandrum. A warm welcome to you, Doctor. Warm welcome to Dr. George Matthews. Sir, you can present your screen, the PPT. So please unmute. Dr. George Matthews. Sir, can you please unmute and present the screen?
Okay, I've unmuted. Am I now audible?
Yes, sir. Yes, sir. You are on.
Okay. Right. So I'm going to
Thank
start
you,
the
sir.
presentation.
Yeah. Yes, sir.
Okay, I've unmuted. Am I now audible?
Yes, sir. Yes, sir. You are on.
So I'm going to start the presentation.
Yes, sir.
How's this? Is it now visible to you?
No, sir.
It's okay. How's this? Is it now visible to you?
It's not visible, sir.
Just hold on. Just hold on.
Yes.
Now,
Yes, sir.
is it fine?
Yes,
Visible?
sir. It's fine. It's visible, sir.
Okay. I'm audible too, I suppose.
Yes, sir.
So, I'm going to speak on the management of sports injuries. I'm speaking from a doctor's perspective. So, I'm going to speak on.
Sorry to interrupt you, sir. I request all the participants to kindly mute yourself. Mr. Syed, please mute yourself. Mr. Chandan, kindly mute yourself. I request all the participants to kindly mute yourself. Mr. Syed, please mute yourself. Mr. Chandan, kindly mute yourself. So you can proceed, sir.
Yeah, I'm getting a feedback from the audio. The same thing is being repeated as an echo. If somebody's some crosstalk is there, I don't know why. Anyway, I'll proceed with my presentation. See, this talk is a doctor's perspective on the management of sports injuries. I understand that there are not only physical education professionals, but also coaches and athletes amongst the listeners. So I greet all of you this afternoon of the 7th of August. I'm very happy that the organizers have chosen me to be one of the speakers. In fact, I couldn't listen to the first speaker. I'm sorry about that because I had two other meetings to attend, a Zoom meeting and another Google Meet before I could join it. Anyway, here I am. Without much ado, I proceed with this presentation. Now, sports injuries, all of you have experienced what a sports injury is. But when you consider management, you must know why it has occurred. Is it an acute injury or is it an overuse injury? An acute injury is really, or in most instances, an accident. It's a sudden injury which sometimes comes without any warning, a fall, a sudden twist of your knee or your ankle. This may not be preventable in all cases, but if the preparation of the athlete in training, in selection, and the preparation of the athlete for the event is proper, many acute injuries can be prevented. Right from for example, the footwear that the person is wearing, the preparation of the playing surfaces, the warm-up, the training that he has had in terms of strength training, flexibility training, all these will add up and contribute to protecting the athlete against acute injuries. But to the sake of understanding this concept, let us now consider this as an accident, like a road traffic accident, which can in many cases be preventable, but when it occurs suddenly, sometimes mostly without warning. And this is an acute injury which can result in a sprain, that is a ligament injury. It can result in a fracture. It can occur. It can produce serious injuries to the head, to the chest, or the abdomen. All these are classified as acute injuries. I am not going to take up the serious injuries like head injuries, spine injuries, chest or abdominal injuries. These cannot be managed outside a hospital. But the musculoskeletal injuries that we classify as acute or overuse can be managed at certain levels in other places, on the field, in the training room, in a camp, in a, what shall I say, in a team that is traveling. So there are places where these injuries are managed depending on the severity of the injury. But whatever be the injury has to be examined by a doctor to get to a diagnosis. And then only you can find out or chart out a program of managing it. And management can be a conservative management or a surgical management. A conservative management would not require surgery or any kind of intervention, no invasive procedures. But when you go for surgical management, the site may have to be operated and then the appropriate procedure carried out. Now, after this conservative or surgical management is initiated, the person will have a period of repair, and after that, he will go in for a rehabilitation phase, and then a very important role for the physiotherapist to administer physiotherapy, to guide the healing, and prepare the athlete for return to sport. So this is a long period. The rehabilitation period is pretty long, and this has to be initially at least under the supervision of a physiotherapist. And sometimes even the physical education teachers and the coaches can also take over once the appropriate communication occurs between the physical education teacher and the therapist. Now, these acute injuries can be a direct injury. That means you get the injury at the site of impact. So here is a punch on the face and the nose is fractured. So that is a direct injury. But it can be an indirect injury. The impact occurs elsewhere in relation to the site of trauma. That is, here is a photograph which shows a person landing on his hands after a fall from a cycle, and he has fractured an elbow or his collarbone where there was no impact, but it has occurred as a result of the forces that travel up the arm that is touching the ground. So in a direct injury or indirect injury, of course, having different consequences, different ways of managing it. These are all hospital managements, so I'm not going to discuss this at all. Overuse injuries. Large majority of sports injuries are overuse injuries, and so many in almost every sport, according to the body part being used in that sport. And these overuse injuries can be managed outside the hospital, which, because these are not very serious injuries, but these can be career-threatening injuries, career-stopping injuries, significant enough for a sports person. These may be considered trivial, minor niggles, pain here and there, soreness. All these are the beginning symptoms of an overuse injury, which could become turned serious and then result in what we call restriction of activities or a premature end to the career of the athlete. Overuse injuries occur due to repeated activity, what we call as repetitive microtrauma. Microtrauma means these injuries are so small, they can be at best termed microscopic injuries, but they will all add and produce the injury which becomes painful. So overuse injuries start as very minor injuries occurring insidiously, mild pains which are ignored, which keep on increasing, and sometimes the input from other individuals around this person will add to the worsening of the injury, because the athlete is asked to neglect these odd pains which crop up here and there with training, which is a very wrong trend. Any pain in the body is a warning signal, and the pain has to be sorted out. And why this injury has occurred requires a proper examination and the diagnosis. And only when the doctor diagnoses the injury can the treatment be decided. The treatment is not just the medical management of the injury, it also requires changes in probably the technique, which is only the biomechanical aspect of performance. It could be related to his physiology of performance. Sometimes it's related to his psychological makeup. It could be related to the environmental conditions. Whether it is too hot, or it's very rainy, there is slushy grounds. So all these factors have to be taken into account when you treat such injuries. If you look at what you call, I think, a very basic schematic of a kind of algorithm how injuries occur, we can look at predisposed athletes who can become susceptible athletes when they are exposed to risk factors. And the susceptible athlete can go in for no injury or rarely an injury. Many of the athletes escape with no injuries, but not always all the time. Most of the athletes get injured once in a while, and that injury sometimes changes their career because it is not treated properly, it is not rehabilitated properly. The communication from the medical team or from the physiotherapist to the coach is not proper, and the coach does something which the medical team may not approve of. The medical team's advice may not be carried out by the coach. The medical team may not communicate with the coach. So there has to be a proper teamwork, right from the athlete who is also the central part of the team. In the periphery, you find all the professionals who are working along with the athletes, who are known as the support staff of the athletes, who will help the person to achieve his best. So there are risk factors, what you call as intrinsic factors, which are due to the inherent factors in the athletes. The previous injury or lack of strength, malalignment, extremes of age. These are all intrinsic factors. In addition, you can have extrinsic risk factors where even the coach's training becomes an extrinsic risk factor. The equipment that the person is using, the footwear, environmental conditions, all these will cause the injury. Now, to understand the healing of acute injuries, I will use this graph. You can notice that the pain is indicated on the y-axis and the healing time on the x-axis. Once an injury occurs, this is the moment of injury. There is a loss of function and then the healing starts. The healing goes up, keeps increasing until it reaches a plateau. The pain at the moment of injury is maximum, and then it increases over a couple of days as the inflammation, because the injured part becomes quite angry, red, swollen, and this is very, very painful unless medication is given. And if this inflammation settles, then the pain keeps decreasing. So the healing occurs and pain decreases, which are of course both are welcome, but this is a very important line. This dashed horizontal line, known as the pain threshold. The pain threshold here. This line, this horizontal red line here, indicates the pain threshold. That means below this line, there is no pain felt by the athlete, and above the line, the pain is perceptible to the athlete. Please notice that after some time, when this line descends and crosses, which is below the horizontal line, the person does not feel the pain. In most people, most athletes, if you ask them, what is the sign of healing? They would say absence of pain. And this is the greatest danger. 99% of people involved in sport believe that absence of pain means absence of injury. That is not correct. In a healing injury, absence of pain only means that they have come some way on the path of healing. Approximately, if you're looking, not even 50% of healing has occurred when this has actually, the pain has disappeared. Therefore, absence of pain should not be equated with healing. One other thing that I want you to notice is look at the healing. This is 100% healing. That means getting back something that they originally had. It never happens. Once a structure is injured, you will not get 100% healing. This is because the tissues that result in healing are not the original tissues. They are modified tissues for repair. And the body has a natural mechanism of healing where this modified tissue is used to fill the gaps in the tissues, which we call as injuries. And so remember, it is better not to have injuries at all. Once an injury occurs, there is some amount of compromise in terms of the tissue integrity, the strength, the flexibility, and all other properties of the tissue. Why? This is true for tendons, ligaments, and muscle. I hope all of you understand what each structure means: a tendon, a muscle, and the ligament. These are all what we call as the soft tissues. And in these soft tissues, healing occurs due to the formation of scar tissue. All of us know what scar tissue means. We have seen scars on our body surface when we have skin injuries, when we have wounds on the skin. They heal with scars which are permanent, which we keep as permanent identification marks if it is on our face or other visible parts of the body. Inside the body also, there can be scars forming in the muscles, in the tendons, or the ligaments. And these scars are meant for stitching together or sticking together, producing adhesion between the torn parts, whether microscopic or macroscopic injury happens. So these scars, the scar tissue is different from the original tissue, so you will not get the original tissue in that area. But the rest of the muscle or the ligament or the tendon can compensate for that small portion of loss. So please remember, it's better not to have injuries at all. And even better, when the injury starts, to take treatment, to get proper advice. The only tissue that heals 100% is, I'll give you a second to think about it, but there's a question, which is the only tissue that will heal 100%? The tissue is bone. The bone heals with the formation of new bone, and after about a year, you get very strong bone, unless there's something unusual has happened, like an infection or non-healing, or non-union or a malunion. But it is supposed to heal 100%. You would have noticed, when I take the example of the bone, that all healing is natural. None of the treatment methods in any system of medicine, and none of these physiotherapy modalities, massage, external medication, none of this will produce healing. Healing is natural. The body has its inbuilt mechanism to produce healing, and it will happen whether you or not you take treatment. Then why do you want to take treatment? The treatment is to guide the healing properly. Human beings, as in other animals, have an extraordinarily high predilection for healing of injuries, but this healing occurs with a lot of functional loss. If you look at all the lame animals walking on the road, you can find the lame dogs, lame birds, lame horses from the race courses. You can find that their function is lost. They have stiff legs, stiff limbs, they limp. We don't want sports people to walk around as lame persons, so we must get the healing to be proper. So what is the actual treatment for a fracture? For example, most of the fractures are treated by just putting a plaster cast. The plaster is not a medicine. Only job of the plaster cast is to keep the fracture from moving. So when you stop moving, the healing will take place. That is true with soft tissue injuries also. A certain amount of period, called immobilization period, is required to get the healing started and for the torn parts to be stuck together before they can be loaded, a controlled loading to guide the healing. Sorry? She said something to me?
No, sir. Participants, kindly mute your audio. Sorry for the interruption, sir.
No problem. In contrast, you look at the overuse injuries. The overuse injuries is not a smooth line. It's like the mountain range, ups and downs are there. We start with a small injury, pain is not perceptible, and you can see that the pain threshold, as in the other graph, is the horizontal line here. And unless pain is felt, the athlete doesn't realize that there is an injury happening. There is an injury, then there is a healing. Injury, healing, it goes up. And suddenly one day the pain becomes very severe. The person cannot tolerate it. And he is now thinking about that moment as the perceived moment of tissue injury, when in fact this injury has occurred in the past as minor injuries which had some amount of healing processes commenced by the body itself. So once it occurs, the person takes rest or treatment and the pain decreases. And when the pain is no longer felt, the person feels that the injury has healed and the person will now resume activity. So we can draw any number of peaks to this graph depending on how many times he got the recurrence of pain. So this is the period of recurrent re-injury vulnerability. This vulnerability is very, very real. Many people, most athletes get this re-injury and the damage becomes more and more. And see, look at this. You get some amount of permanent loss even if you take treatment at this late stage. To prevent permanent loss from occurring, you have to start by taking treatment when the discomfort, the soreness, or the mild pain is perceived. Then, if you take treatment, the permanent loss can be decreased. Now, the ligaments and tendons are made up of collagen tissue. And this collagen tissue like this, see, when you stretch the tendon or the ligament, first there is stretching of the crimping, that is the wavy pattern of the fibers inside. Then you have a straight fiber pattern. Finally, before a partial rupture occurs, there is an intermediate stage of partial rupture. So this is a degree of injury, which I'll take up a little later. So we find that the body's tissues can take up some amount of stretch, but beyond that it will rupture. So this is a kind of stretch that most athletes will undergo in minor injuries, which have no consequence in their career. But remember, once it has occurred, there could be a minor amount of partial rupture if the person is having pain on the initial day or first couple of days. So then the person must seek assistance. And when healing occurs, look at this. The healing goes through 3 phases, and these 3 phases are not separate. These 3 phases overlap. The first phase, the red graph, is the phase of inflammation, when there is pain, when there is swelling, sometimes redness. The person cannot move properly. The painful movements are actually perceived very, very well, and the person will seek some assistance. And after that, the repair phase starts when the body part that is injured has to be kept relatively immobilized so that the healing will occur. And then we go in for the remodeling phase or the rehabilitation phase. Again, you see that overlap of this green line. This is, of course, very, very variable. It can even go up to 1 year. For a ligament, it takes from 6 months to 1 year. And how many of us are really ready after an ankle sprain to wait for full recovery, to wait for 1 year to get the ankle solidly healed, which most of us don't do. As a result, the injury becomes a recurrent injury, which occurs again and again. So this remodeling phase, where the rehabilitation is administered, is an important time for the physiotherapist to step in and guide the process. So there can be supervised physiotherapy sessions, or the physiotherapist can then give advice for the person to carry out at home or in the hostel or in the training camp. So this, if the physiotherapist is staying with the team, it is very good. And most of the teams are lucky enough to have physiotherapists staying and traveling together with the team, traveling to tournaments, staying in their training site. So this will help the athlete to recover from injuries in a proper scheduled manner. These, for example, here is an acute injury. I'll just use some schematic diagrams. I'm not going into actual photographs of the injuries, which are not really required for this audience. So if you look at this, as you see, this is a grade 3 rupture of an ankle ligament. It is grade 3 sprain, which is a rupture of the ligament. This will never heal even if you keep it immobilized. Suppose you put plaster, it is not going to heal. If it's a fully torn ligament, it has to be stitched back where surgery is required. Surgery has, in most cases, to be done to correct this gap. And this is a muscle tear. This is a minor tear. This is a muscle strain. If you look at it, the rest of the muscle is okay. The muscle is not torn. These gaps can be closed if some amount of initial period of rest is taken and then a proper rehabilitation is carried out. Shin pain is a very important overuse injury. That was an acute injury, and here is an overuse injury. Many of you, as beginners in a training program, would have felt that pain in the shin is a troublesome pain which refuses to go away. There are some causes for getting shin pain, even a fracture of the bones, a stress fracture that comes on slowly. An overuse injury can produce shin pain. There could be problems in the muscle. There could be problems in the strain. That is with strained muscles. You can have problems with the pressure inside the muscle compartments. Here is a cross section which shows the muscle compartments where it is strained. The pressure cannot be tolerated by the athlete because of the increasing swelling, which are some ways related to the way that the person trains. The knee is a very important joint and a very complex joint. There are so many injuries that could occur even in the smallest parts of the body. And my 30 years of experience tells me there is no body part in an athlete which cannot be injured. An athlete can injure any part of the body. And depending on the sport, there is, of course, a predilection for certain areas. But almost as you sit in consultation, you get injuries to almost every part of the body due to every possible reason. This is because sports movements are unusual, which are not really required for moving around as a human being who is not in sport, a sedentary person for living, working, playing, may not be getting those injuries which a professional sports person would be getting. They are going all out, that is the profession, and they try to show their abilities on the field, the best of their abilities, which will result in injuries that can be, of course, harmful to their career. Here is the graph that I showed you earlier to illustrate the where approximately the tear occurs. And just see, this is just showing the percentage of deformation that a tendon can take. It can take only about 4% of this deformation. That means if you stretch it to a 4% higher length, there is going to be a damage. This is only up to here you have a normal elastic range for the tendon. After that, some of the fibers will break. When it is a mild one, it breaks up. It goes up to here, you get a mild break. A second degree tear can occur as it goes up here, and I look at 10% of stretch. So, 10 centimeter long ligament is stretched to 11 centimeters. A 10 centimeter long ligament is stretched another centimeter. You can tear it completely. This is something that everybody must be careful about. You cannot go beyond limits. Why do we require ligaments? There are ligaments around all the joints. Ligaments are actually important for the stability of the joints, and they will support the joint in such a way that abnormal movements are prevented, but normal movements are allowed. Without the ligaments, abnormal movements will occur, and normal movements will become difficult. So the ligaments are not totally immobilizing the joints. Ligaments are keeping the joints mobile but stable, allowing the movements that should happen in the joint, but preventing abnormal movements. So abnormal forces produce abnormal movements that will rupture the ligaments and destroy the stability. And without a properly healed ligament, there cannot be stability. If you look at the return to participation, there are so many things that can be actually handled here. There are, here is something that the physiotherapist should be handling, or physiotherapists handle. They'll take care of all the functional muscle defects, biomechanical deficits like the weakness or the relative imbalance of muscles or flexibility, lack of flexibility. They can even suggest changes to the coach in the training because they closely observe the training on the field side. As I told you earlier, physiotherapists attached to teams are going to have great help. They bring in knowledge from the medical field to the coach or the physical education teacher, And at the same time, the physiotherapist forms a liaison between this coach, physical education teacher, and the doctor. So when there is a doubt for the physiotherapist, they consult the doctor. There can be injuries which have to be actually overseen by the doctor in the rehabilitation phase also. There could be obstacles in rehabilitation where the doctor would have to intervene and suggest something which can form a new form of treatment plan here. Now see, if we can consider this as a pyramid or as a triangle, the base, the most important part, the base of the pyramid, well, the most important part of healing lies in the initial management by the doctor primarily, where you have the injury and the treatment is made, and then you have either surgery or immobilization or bracing, and in the immediate post-injury phase after 2-3 days, when there is, of course, a requirement for slight mobilization or for the requirement of modalities, physiotherapist also steps in with his expertise in giving physiotherapy. And after that, there is a general recovery for any sport, and then the top of the triangle, the ultimate recovery occurs when the pyramid is built to its total height. And so you can build higher only if the base is strong. So if the initial management is wrong, you cannot build higher. The pyramid will collapse. That is to be remembered. Many of you ignore the initial treatment, sacrificing the initial treatment for a tournament or for some selection or for a chance to be on the team. They say, okay, I'll play this game and come back and take treatment. The healing process will not wait for the athlete to complete an examination or a selection or to complete a tournament. It will go on in a wrong manner, and healing will not occur. So the pyramid cannot be completed. So what is the requirement for proper healing? Have the base done properly. If the base is proper, you can build on it. If the base is not strong, you cannot build on it. You cannot come back and rebuild the base. The chance is lost. You would have missed the bus. So the healing takes place initially. A common example is the shoulder. A shoulder dislocation is seen in a hospital, managed, immobilized, strapped, and they are given an advice 3 to 4 weeks not to take off this strapping, so let it heal. The athlete comes back home or to the hostel or to his training camp. After a week later, he pulls off the tape and starts playing. And what has he done? He has actually eroded the base that the doctor was building up for the healing. And now he will have a shoulder which will heal as a very weak shoulder that is unstable. And this guy, whenever he tries to lift his hand up, will get a dislocation and he'll do something to put it back. He'll have a very loose shoulder. So he has now damaged the recovery process of his own shoulder by very foolish means. If you look at this, I just wanted to show you the number of cells in the body which contribute to healing, injury, the repair and the remodeling phase. In every phase, there are cells acting. Up to repair phase, it is mostly very, very prominent. In the rehabilitation phase, there are only minor contributions occurring for repair of the daily minor microscopic damage that occurs with exercise. But in the first phase or the second phase of the repair, you will have a lot of contribution from the cells. My question to you, think for a few seconds, where do these cells come from? Where are the cells in the body for healing? These cells are in the blood. And so bleeding is a natural process of the body to bring the cells required for healing to the injured site. But bleeding can be dangerous. Bleeding can be a nuisance. Bleeding can be harmful to the body because body does an excess of the procedure of healing, because we all follow nature's rules. What is the nature's rule regarding an injury? Nature's rule regarding an injury is to get the animal back on its feet as quickly as possible so that it can find food, take shelter, and run away from danger. So, the beauty of the leg, the length of the leg, presence or absence of a limp or a deformity does not matter. It has to be pain-free, and the animal should be able to walk or run. If you watch the wild life films on television, you see sometimes herds of animals, herds of deer, herds of cattle, herds of buffaloes, or herds of wildebeest in Africa. How many of these are injured and limping? There are so many injuries occurring because it is the battle for survival. Why don't you find these animals injured? The reason is very simple. The injured animals will slow down and it will be caught by the predators. They don't survive. They die in a very short time. So, the nature's process is to reduce death in these injured people. As far as possible, let them survive. But when an attack occurs from a predator, they target the injured animals or the old animals or the very young and take them as their prey. So this need not happen in athletes. Athletes should not become invalids, handicapped people. They become handicapped in terms of inability to attend to their sport because of improper treatment. If you allow proper treatment to occur, if you follow nature's rules, healing will occur really well with minor deficiencies. If you do not allow that to happen, and if you don't build the base of the pyramid, you will not reach the apex of the pyramid at all. However long you might try. Many people try for months and years to get back to their original self, their original abilities, trying to work on a very weak base. Once the base is weak, you can't get proper healing. So remember this very, very well. The healing time is immediately after the injury. In the first 1 to 1.5 months, about 6 weeks. If this period is not taken care of, if it is ignored, if healing is neglected, it will not heal properly again. See this the injuries. Now I'll take up with this graph. I'll show you what is to be done in each phase. Now this is the phase, the first peak, where immediately after the injury there is a lot of swelling, there's a lot of pain, inability to move, and sometimes you find redness, sometimes you find bleeding, discoloration under the skin. This is when the body is produced blood from the vessels and discharged into the areas which are injured. And here, look at this. In this period, what is to be done? How will you help healing? Is bleeding is the reason why healing occurs. Blood is the carrier of all this, the carrier of all these cells. If they have to carry these cells, is bleeding welcome? Is bleeding desirable in the area? The answer is yes and no. We need only small amount of blood for healing. The rest of the bleeding should be controlled. All these cells that are carried by blood will be available in a small amount of blood. We need to have only a small amount of blood. We don't need excess. Give you another example. Suppose you want one of your textbooks, one page sheet has come off, and you want to stick it back very carefully. You would apply a very thin line of adhesive and put back the paper, align it properly, and stick it back. That means the torn sheet will stick back. There is no excess gum. Other sheets are not stuck together. The book is still readable. You can flip the pages, no problem. It looks very, very good. Almost as good as the original one. Suppose you want to make this is a very strong adhesion. You give it to a child in primary school. You give it's completely stuck. So when only small amount of gum was required, we put a large amount of glue. The entire place gets stuck into one immobile scar, a mass of tissue which does not permit movement. So what is required is only a tiny amount of glue. So how can you control the bleeding from outside? Can you give some medicine to control bleeding? No. Very simple first aid that is given during bleeding is ice. You must have been told by the earliest speaker that ice can be used as part of first aid. And you've been told the acronym, I'm sure, about RICE or PRICE. All these acronyms contain I, which means ice. If you apply ice properly, the vessels that are bleeding will narrow, the diameters will reduce, there is a constriction of their opening, and the bleeding will decrease, and only a small amount of blood exudes into the injured tissue. This blood brings the cells for healing, at the same time prevents unnecessary large scar formation and loss of mobility and strength. So proper application of ice is very, very important in creating the base properly. That means you have set the ground, set the arena for healing to happen normally with the slightest amount of blood that is required to bring in the cells for healing. So this is the time when you also give some medications, maybe a couple of days, to bring down the inflammation. Because few hours after the injury, after the bleeding, you find it is swelling up. For example, the ankle you'll find is swelling up. The next day also it will swell up. And swelling inside the body is like glue. It will make all the tissues stick together. This stuck together, non-immobile tissue again becomes a hindrance to proper rehabilitation. So the swelling has to be controlled. How to control the swelling? Number one, by ice. Ice will control not only bleeding, it will also control swelling. That means you have to continue using ice for about 24 to 48 hours. At the same time, you take medications to control the swelling. So you'll find a reasonable swelling, a very small amount of swelling persisting. That is essential for healing, but not in excess. So you actually manipulate the body's healing process here to get the right amount of fluid, right amount of tissue fluid there, plus the right amount of blood to commence healing. And in the repair phase, some degree of immobilization is required. If it is bone, it has to be total immobilization. It is a severe ankle sprain, a ligament injury. Again, it has to be immobilized mostly with plaster casts or sometimes with a brace. If it's a minor ankle sprain, you can try an elastocrete bandage around and walk with that, or you can walk around without bearing weight using crutches. That depends on the site of the injury and the severity of the injury. That is for helping heal. When the injured edges are not close by, when they are not approximated, healing will not occur. And if you keep moving the injured area, healing will never occur. For the body to heal the injured tissue, you have to keep it together like this, so that the bridges are created by the tissues, the cells that have come in the blood. So some amount of immobilization is required in the repair phase, and severe injury is required for at least 6 weeks. A typical severe ankle sprain will be having a plaster cast to protect it for 1.5 months, that is 6 weeks. And once it is removed, and even before that, the rehabilitation starts when the physiotherapist will have lots of things to do. Even when the person is in the plaster, there is a need for maintaining mobility of the person, to maintain the conditioning of the person. He can give things or activities which will not affect the casted limb. It can help in the movement and the rehabilitation. And then once it is removed, it has to go through several stages of exercises combined with sometimes some modalities, and especially sometimes with ice application. There are techniques for the therapist to get the movement properly functioning without producing a lot of pain or inflammation in the area. Even ice is a very good choice during rehabilitation. There's in fact a method called as cryokinetics, where you combine ice and exercise, which the previous speaker would have touched upon. So this rehabilitation is very individualized. Like from the initial period, the treatment is individualized, of course. Depending on the sport or the person's ability, we decide what is the treatment required. If it's a very active person who is going to have the ligament stretched every day, you may have to have an immobilization which is more strong, and sometimes surgery is chosen to repair the ligament. Once the rehabilitation phase tapers, you have to coming to the top of the pyramid, where you have sport-specific fitness being brought in. So the initial part of the rehabilitation, it is recovering the basic properties of stability, flexibility, and strength. And then you go in the second half of the rehabilitation remodeling phase. You bring in the general sport fitness, and then the final period, person slowly enters into the specific sport of his or her choice, and you have sport-specific rehabilitation. This sport-specific rehabilitation is now the honors of the sport-specific rehabilitation transfers now from the physiotherapist onto the coach and the physical education teachers. So you see how the hierarchy is now slowly moving, and then you find that the coach and the teacher takes care of a lot of activities that can be done on the field, and then the ultimate responsibility is given to the athlete to carry out the activities in most occasions after some time without supervision. So you find the hierarchy of management, the hierarchy of treatment also is paralleling the graph. When there is an injury, when there is an immediate need, this is the time when the doctors have to be consulted, the hospitals have to be visited, proper treatment there, either conservative or with surgery, proper immobilization decided by the doctors. And as the doctor's role becomes lesser, the physiotherapist takes over, and the physiotherapist now guides the rehabilitation with occasional input from the doctor, so that the person keeps on recovering. And then this is now transferred, the onus, the responsibility is transferred for supervision to the coach and the physical education teacher, and ultimately to the athlete. So that is what I have listed in this. You must have this kind of hierarchy in the management of an injury. And the ultimate responsibility of recovering fully comes to the athlete. The athlete can also be helped with the masseur if the therapist feels it is safe to massage the injured area. So the physiotherapist, of course, they have some specific techniques for managing some overuse injuries using deep tissue release. This is a very modified form of massage, but that cannot be done by the masseur. But the physiotherapist can assign the job of a general massage to the injured areas if he or she feels that the masseur or the masseuse can do it. But otherwise, the management hierarchy now slowly is now the responsibility of the higher positions will slowly decrease, and the athlete is now finally left alone. If this is not followed, you find that athletes skips the process, or the athlete ignores the advice given by the doctor, or later the advice given by the therapist, or later the advice given by the coach, or the interventions by the masseur. Athlete will ultimately find himself or herself alone with an injury that has not healed, which does not seem to be healing at all in any time in the future. So this sources of help, where to find help, sources of information, sources of whom do you consult? This has to be followed. If you don't heed the advice at all these levels, there is no need for a doctor to follow up the athlete during rehabilitation phase, even after 6 months. They are actually almost recovered, but they are not fully fit. The therapist has to do that, and they will most preferably be attached to the team so that they can guide the athlete properly. So this is the hierarchy of management. If this is followed, you get a proper healing, a desirable outcome, and a happy athlete. For that, what we require is time. Time cannot be actually be decided. It's a blanket decision that all ankle injuries will require these many months. No, it is all injuries, like all diseases, are very individualistic, specific, athlete specific, sport specific, age specific. Like taking into account of all these factors, the environmental factors, the peer pressure, the pressure from external sources, all this has to be taken along with the psychological bearing that this has on the athlete's recovery. And only then would this entire team be able to help the athlete. And the central part, the central location of the athlete in this rehabilitation process shows that the athlete can go and seek the advice of the doctor anytime he wants. You will not have to go up the hierarchy. This is very important. This cannot be actually be prevented by anybody. That athlete cannot consult a doctor because it's so many months after the injury. The doctor can be approached anytime. Athlete in rehabilitation on the field can go back to the physiotherapist and ask what else is to be done. The coach can be consulted every day. Similarly, the physical education teachers. Bashers can be consulted when they not consulted. Their services utilized for massage, general body massage, but specific massage to the sports, the injured area, only with the advice of the physiotherapist or the doctor. So this brings me to the end of this short presentation. I can only give you in this presentation, I could only give you the scientific principles which help us to manage it. If you go beyond scientific principles and try to find non-scientific or pseudo-scientific healing, it will never happen. There are lots of quacks who produce or provide a pseudo-scientific advice. If that will only worsen the injury, ultimately. Follow the proper advice, seek the professions which are actually enabled or properly appointed for that particular purpose. So the injury, again combined to the graph, wherever you are in the stage of the injury, if you take the appropriate treatment according to the stage that it dictates, you can reach the ultimate goal with the very minimum loss. And the goal of the athlete and the entire team must be to reduce the final compromise that occurs in performance or stability or strength or flexibility of the injury. With that, I conclude my talk, and thank you very much.
Thank you, doctor. Thank you, doctor, for providing deeper insights in sports injury management. I'm sure participants are benefited by your informative talk. So there are a few questions as we are running short of time. I'm just picking up two questions
Yes.
for you, doctor. The first question is, what is the best management for an old common peroneal nerve injury in a young sportsman? What is the best management for an old common peroneal nerve injury in a young sportsman?
I need to know how this injury occurred, and secondly, how old is the injury? Please get back with that response.
Yeah, we'll get back, sir. We don't know who
We'll
is
take the second question.
The second question, sir. What is the reason for recurring knee pain? There is sudden appearance of knee pain and followed by its disappearance. What is the reason for this recurring knee pain?
Unfortunately, I cannot answer any such question because it is just I'm going to be trying to speculate what it is. Sports injuries cannot be diagnosed by the vague symptoms that you present to me. Unless I take a proper history, talk to the injured athlete and examine the knee, I will not be able to get to a diagnosis. So I don't want to
Sir-
speculate. I don't want to speculate on what it is. So I would rather say I am unable to answer it now.
So one last question. Unlike in the past, ACL injuries are more common now. Can a sportsman get back to the normal game after the ACL injury?
ACL injuries are common and they can be managed either conservatively, very rare, or most commonly by surgical techniques. Conservative management is for people who are extremely muscular and have very good stability. So again, the examination of the athlete is important. The knee is stable. When the doctor examines and finds that the knee is very stable and that the degenerative changes or the secondary changes that are occurring in the knee joint are minimal, then we can go in for conservative management. I have some athletes who have refused surgery and gone to a conservative program with very strong knees. I have seen them more than 30 years ago. They're still going strong without any degeneration or arthritis. So that is possible, but these are, of course, exceptions rather than the rule. Most ACL injuries require surgery because ACL produces produces an instability of the ankle. Sorry, instability of the knee joint, which has to be corrected. Otherwise, secondary injuries, other injuries like meniscal injuries or articular cartilage injuries can occur. So leave the decision to the doctor who will examine and decide the degree of stability in the knee joint.
Thank you, doctor. Thank you so much, doctor. In spite of your busy schedule, you have joined us this webinar. Thank you for the insightful talk too. I now request Mr. Srinivas, member, Physical Education Federation of India, Karnataka, to speak a few words.
Thank you, madam. Thank you very much. It's my proud privilege. It was a wonderful session by our both the resources. First of all, I thanks to our first speaker, Dr. Nitin Prakash. Nitin Prakash has spoken about the it's a very informative session by Prakash Nitin sir. He spoken about what are the precautions to be taken when there is an injury, what are the measures to take the things. He's a sports psychiatrist of Alvas College. Thank you, sir. It was a wonderful session. Thank you very much, Nitin Prakash, sir. Thank you.
Thank you, sir.
Thank you. And another one thing is on his busy schedule, Sarvaz with another meeting is there with another one session. We requested to George Matthew sir in the last 2 days back. He's agreed to in the national webinar. Given an insightful session by sir. He spoken about the rehabilitation of injury measures has taken. What are the measures has taken in the injury time and other things. Thank you, George Matthew sir. Thank you very much. And also, I extend my thanks to our Indian Academy principal sir, Xavier sir. It was a wonderful webinar organized by Indian Academy. Thank you, Xavier sir. And also, I extend my thanks to our Indian Academy team members, all the Indian Academy family members. Thank you. And also, I extend my thanks to our physical Sri Prasanna Gowda sir. Thank you, sir. Thank you very much. And also, I extend my thanks to our PEFI India, Physical Education Foundation of India. Thank you, sir. Thank you very much. And also, I requested to join PEFI Karnataka chapter, PEFI India. Thank you, sir. Thank you very much, sir.
Thank you and goodbye.
Thank you, Mr. Srinivas. The best and beautiful things in the world cannot be seen or even touched. They must be felt by heart. Thank you is one such word among them. And I now request Professor Keshwan, Department of Business Administration, to propose the vote of thanks.
Whatever level you reach, getting better never stops. Quote by Sachin Ramesh Tendulkar. It's my rare privilege to propose vote of thanks on this day. I'm certainly delighted in expressing sincere and heartfelt thanks and gratitude to the most respected resource person of this webinar, Dr. Nitin Prakash, Assistant Professor and Consultant Sports Physiotherapist, Alvas College of Physiotherapy, and Dr. George Matthews, Associate Professor and Medical Officer, Sports Authority of India, Lakshmibai National College of Physical Education, Trivandrum. I am grateful to you, sir, for accepting our invitation in such a busy schedule for igniting the minds of the audience by sharing your knowledge and skills effectively. I, Keshwan, Assistant Professor, on behalf of Indian Academy Degree College Autonomous, would like to express thanks and gratitude to you, sir. I take this opportunity in extending my heartfelt gratitude and thanks to the Chairman of Indian Academy Group of Institutions, Dr. T. Somsekhar, for all his support and being a patron in chief for this webinar. Thank you, sir. I'm indebted to thank Mrs. Bharati, Secretary, Indian Academy Group of Institutions, for her encouragement and motivation. Thank you, ma'am. My heartfelt thanks to Dr. Srinidhi K. Parthasarathi, Chief Operating Officer, Indian Academy Group of Institutions, for his periodical monitoring and solid support in all his aspects as we grow. Thank you, sir. I render my sincere thanks to Dr. E. Jerome Xavier, Principal, Indian Academy Degree College Autonomous, for awakening the desire and passion to support us as a ladder to reach the pole of success. Thank you, sir. My special thanks to Mr. Srikanth, Secretary, Physical Education Foundation of India, Karnataka, for his support and guidance. Thank you, sir. And I also thank Mr. Srinivasan, sir. I also thanks the organizing team for their effortless support. Thank you all. Have a great day. Stay home and stay safe.
Thank you, Professor Keshwan. Once again, I thank everyone who have participated in this webinar. Special thanks to our source persons, Dr. Nitin Prakash and Dr. George Matthews, and also to Mr. Srinivas and Mr. Srikanth, Physical Education Federation of India. Thank you, everyone. Have a nice day. The feedback link is posted in the chat box section, and you will receive your certificates by tomorrow. Kindly fill the feedback forms. The link is posted in the chat box.